Imagine feeling the first contraction. You are surrounded by trees, stone, smoke, and animal skins. There is no hospital nearby. There is no hospital anywhere. No surgery, no antibiotics, no blood transfusion, no monitor showing the baby's heartbeat. And yet, you are probably not alone. Someone is holding your shoulders. Someone is keeping the fire alive. Someone older is watching every movement of your body, searching for signs she has seen before. Long before medicine became a profession, birth may already have depended on one of humanity's most powerful survival tools, other humans. But how did ancient women actually give birth? What did their companions know? And what happened when something went wrong? The honest answer begins with a problem. Childbirth leaves surprisingly little evidence behind. A stone spear can survive for thousands of years. A human bone can become a fossil, but the hands that supported a laboring woman disappear. So do the plants, animal skins, wooden supports, water containers, spoken instructions, and rituals that may have surrounded her. Archaeologists can reconstruct ancient shelters, diets, injuries, and migrations. Birth is harder. There is no preserved scene showing exactly what happened beside a fire 40,000 years ago. So researchers must combine several kinds of evidence: fossil pelvises, human anatomy, evolutionary biology, historical records, and observations from more recent small-scale societies. These clues cannot give us one universal prehistoric birth story, but together they reveal something important. Human childbirth was never only a biological event, it was also a social one. To understand why, look at the human body. A human baby does not simply move straight through the birth canal. In most births, the head and shoulders must change position as the baby travels through the pelvis. This turning process is called rotation. The fit can be extremely tight. Humans give birth to babies with relatively large heads and broad shoulders, while the shape of the pelvis must also support walking, internal organs, and the pelvic floor. Scientists once explained this mainly through the obstetrical dilemma, the idea that walking upright demanded a narrow pelvis while larger brains demanded a wider one. Researchers now know the story is more complicated. Pelvic shape varies widely. Temperature, body size, metabolism, the pelvic floor, fetal growth, and several evolutionary pressures may all have influenced birth. But the central problem remains. Human birth can be difficult, unpredictable, and dangerous. Anthropologists Wenda Trevathan and Karen Rosenberg have argued that this difficulty may help explain why assistance during birth became so deeply rooted in human life. In many non-human primates, a mother gives birth without active help. Humans are different. Across cultures, people commonly assist the laboring woman. That does not prove that every ancient woman had a trained midwife beside her, but it suggests that seeking help during birth may be extremely old, possibly older than Homo sapiens itself. Now place yourself inside a mobile group of ancient humans. Pregnancy would not have removed you completely from daily life. Food still had to be gathered. Tools still had to be made. Children still needed attention. The group still had to move when water disappeared, prey migrated, or the weather changed. But as the pregnancy advanced, your abilities would change. Walking long distances could become harder. Carrying heavy loads could become dangerous. Hunger, illness, and exhaustion could affect both you and the developing baby. This is where the larger human support system mattered. Humans are often described as cooperative breeders. That means mothers do not raise children entirely alone. Fathers, grandparents, siblings, and unrelated group members may help provide food, protection, caring, teaching, and childcare. Anthropologist Sarah Blaffer Hrdy used the term allomothers for people who care for a child but are not that child's biological mother. This cooperation does not look identical in every society, but shared care is one of the most distinctive features of human childhood, and the support may have begun before the child was even born. As labor approached, the woman and her companions may have chosen a place that balanced privacy with safety. It could have been inside a shelter, near a fire, behind a windbreak, at the edge of the camp, or in a familiar place close to water. We cannot know which arrangement was most common. Different climates, cultures, and human species probably developed different practices. Some births may have involved several helpers. Others may have involved one experienced relative. A woman caught far from the group may occasionally have delivered alone. prehistory lasted far too long, and humans lived across too many environments for one scene to represent everyone. Still, experience would have mattered. A person who had witnessed many births could recognize patterns. She might know when labor was progressing normally. She might notice when the baby's position seemed unusual. She might understand how to support the woman's body, when to encourage movement, and when the situation had become dangerous. This knowledge did not need writing. It could pass through observation. A girl watches an older woman. Years later, she helps during another birth. Eventually, others begin watching her. No classroom, no textbook, but still a form of education. When contractions became stronger, the woman probably did not remain motionless in one position throughout the entire labor. She could walk, lean forward, kneel, squat, hold another person, grip a branch, hide strap, wooden support, or the shoulders of a companion. There is no evidence that one position was used by all ancient women. Human societies have used many birthing positions, and pelvic anatomy also differs from person to person. What likely mattered was movement and adjustment. The woman could respond to pain, exhaustion, the baby's descent, and the instructions of the person helping her. The sounds of labor may have filled the shelter: breathing, moaning, instructions, the crack of burning wood, perhaps singing or rhythmic vocal sounds, perhaps silence. A companion might press against the woman's lower back. Another could offer water. Someone might replace damp skins beneath her. Warmth would matter, especially in a cold environment. So would protection. A long labor could leave the woman exhausted and less able to respond to danger around the camp. Then the baby began to emerge. This was one of the moments when assistance could become especially valuable. Because of the direction human babies often face during delivery, it can be difficult for the mother to see or safely guide the baby alone. A helper could support the head and body. She could prevent the newborn from falling onto hard ground. She could move the baby toward the mother. She could notice whether it was breathing. But every birth was different. Some may have happened quickly. Some may have lasted through the night. Some babies arrived feet or buttocks first, a position known as breech birth. Some became trapped. Some labors stopped progressing. Without surgery, modern medication, or reliable ways to monitor the baby, a complication could transform a familiar process into a crisis. And this is where ancient knowledge reached its limits. Social support could help. Experience could help. Position changes could help. But they could not solve everything. A severely obstructed birth could kill the mother, the child, or both. Heavy bleeding after delivery could become fatal. A retained placenta could cause bleeding or infection. High blood pressure disorders could cause seizures. Bacteria entering damaged tissue could produce an infection that no plant remedy could reliably cure. We do not know the exact maternal death rate in deep prehistory. Anyone who gives a precise percentage is claiming more than the evidence allows. Historical records from much later pre-industrial societies show that maternal death was far more common than it is in countries with reliable modern care. Those figures cannot simply be applied to people living 40,000 years ago, but they show how serious childbirth remained even in societies with experienced attendants. If the delivery succeeded, the danger was not immediately over. The newborn needed warmth. Its breathing had to begin. Its body was wet and could lose heat quickly. Someone may have cleared fluid from its mouth and nose, rubbed its back, wrapped it in soft material, or placed it against the mother's skin. The umbilical cord eventually had to be separated. A sharp stone flake could cut plant fiber, hide, meat, and a cord. A cord could also be tied with sinew or fiber, but we do not know exactly when prehistoric people cut it, what they tied it with, or whether different groups followed different rules. Claims that ancient people routinely practiced a specific modern cord clamping method cannot be proven. The placenta also had to be delivered. It may have been buried, burned, left away from camp, or treated ceremonially. Many later cultures developed powerful beliefs around the placenta and birth, but those traditions cannot automatically be projected tens of thousands of years into the past. The most responsible answer is uncertainty. Ancient people almost certainly understood that the placenta was connected to birth. What they believed it meant is usually lost. Then came feeding. A healthy newborn needed milk, warmth, and near constant attention. But breastfeeding did not always begin easily. The The mother could be injured, exhausted, ill, or unable to produce enough milk immediately. Another lactating woman may sometimes have fed the child. Older relatives could bring food and water to the mother. Other people could care for older children. Someone else could carry firewood or gather plants. The birth might have lasted hours. Recovery lasted much longer. This is where cooperative care may have made the greatest difference. Human infants are unusually dependent. They cannot walk. They cannot cling as strongly as many other primate infants. They require years of feeding, protection, teaching, and carrying. A mother recovering from birth while caring for a newborn would benefit enormously from help. Grandmothers, fathers, siblings, and other helpers could contribute food, childcare, practical knowledge, and postnatal support, though the amount and kind of help would have varied between communities. And not every story ended with survival. Some babies were stillborn. Some died within hours or days. Some mothers did not recover. For most of human history, childhood itself was extraordinarily dangerous. Prehistoric rates cannot be calculated with precision, but disease, injury, malnutrition, cold, and infection would have placed newborns at constant risk. The survival of our species does not mean birth was safe. It means enough mothers and children survived for one generation to continue into the next. Ancient families also grieved. The belief that high mortality made parents emotionally indifferent is not supported by what we know about human attachment. Rare infant and child burials show that at least some young lives were treated with care after death, but burial was only one possible response. A body might be carried away, wrapped, placed in a natural opening, cremated, or treated in a way that left no trace. Once again, archaeology preserves only fragments. The emotions surrounding the loss are even harder to recover. What may be easier to understand is the hand placed on another person's shoulder, the food brought to someone too weak to gather it, the child carried while its mother rested, the older woman staying beside the fire because she knew the labor was not finished. These behaviors rarely fossilize, yet they may have been just as important to human survival as stone tools. Modern research offers an echo of that ancient social pattern. Continuous support during labor can improve several outcomes, including increasing the likelihood of spontaneous vaginal birth, slightly shortening labor, and reducing negative feelings about the experience. That does not mean ancient birth was safer than modern medical birth. It was not. Antibiotics, blood transfusions, sterile surgery, trained obstetric teams, and emergency care save lives in ways prehistoric assistance could not. The strongest modern system is not a choice between medicine and human support. It combines both. So, how did ancient women give birth? Not through one secret technique. Not because their bodies were magically stronger, and not because pain or danger mattered less to them. They gave birth with the anatomy humans still have today. They faced complications humans still face today. But instead of machines, written instructions, and emergency operating rooms, they depended on observation, memory, experience, and the people around them. A knowledgeable helper could not stop every tragedy, but she could provide warmth, balance, water, protection, encouragement, and a pair of hands ready when the baby arrived. Imagine feeling the first contraction 40,000 years ago. No hospital door would open, but somewhere beside the fire, human hands may already have been reaching for you.